Welcome to Raven Medical's online Workplace First Aid Certification Program. You never know when you will have to provide first aid in the workplace. This online blended program will cover some additional information that is required within a workplace first aid program for the province of Alberta. Some of these additional topics are an overview of health and safety legislation as it relates to workplace first aid. One of these requirements is the development of a first aid plan for every work site. Another topic you must be familiar with is the completion of first aid reports and record-keeping requirements. We'll discuss some of the special considerations for workplace first aid, such as AEDs, oxygen administration, and medications. The final topic of this presentation is a brief discussion on the differences of a wilderness first aid course and the requirements of a workplace first aid for the province of Alberta. So let's get started and have a look at some of the legal information that we need to review for our workplace first aid. The first legal tidbit you need to know is that if you do provide first aid at a work site, generally you're covered by the Good Samaritan Act, which gives you some legal protection for the care you give. However, this protection does not apply if your job description includes providing first aid to your coworkers. So check with your employer regarding your job expectations. A second legal consideration is the fact that every worksite must have identified and available first aid services, i.e. a trained person, and first aid equipment and supplies. If there are multiple employers at one site, then one employer will be identified as responsible for first aid. This employer is referred to as the prime contractor. Make sure you're familiar with who is the prime contractor and the first aid services available at your worksite. Through this risk assessment process, the level of first aid provider and the amount of first aid equipment can be determined for each individual worksite. Some of the considerations include work hazards, described as low, medium, or high hazard work, the number of workers on site, and the site's distance to medical care. For more details, please see Alberta's Occupational Health and Safety Bulletin, First Aid in the Workplace. There are 6 components of a good first aid plan. First, the plan needs to be developed in collaboration with the Health and Safety Committee. Second, they review all potential hazards, looking at the types of injuries and illnesses that are likely to occur and include some worst case scenarios. Third, from this hazard assessment, they'll determine the level of first aid supplies and services that are required for that work site. A lot of that information is stipulated in various legislation within Alberta. Fourth step is to develop an evacuation plan. Employers must come up with a plan to transport injured or sick employees to a healthcare facility from each work site. Fifth step is to write the plan down and make sure it's clear and understandable. And sixth and last is to share the first aid plan with all employees. Once the first aid plan's done, then you can start the working at the work site. First aid reports. I know, nobody likes doing the paperwork, but they're actually really important and they are a requirement under Alberta legislation. Any work-related injury or sudden illness must be reported to the employer and the employer must complete the proper documentation. It is the employer's responsibility to complete all first aid reports, but you must ensure that your name is on the report and a description of the first aid given is included on that report. The employers are responsible for keeping all records for a period of 3 years. As well, you should be aware that all first aid reports may be accessed by occupational health and safety officers and other WSIB-related inquiries. Let's look at some special considerations for workplace first aid. We'll begin with automated external defibrillators. The need for a worksite AED should be assessed as part of the first aid planning development. If an AED is available at a worksite, the employer should ensure that the following items are included. A competent person must be available to operate the AED. This involves appropriate training and an ongoing update and recertification plan. As well, the employer should have a quality assurance program in place to address such things as ongoing maintenance, checking the batteries and pads, and keeping the unit clean and available. AED use is part of Raven Medical's training and certification. As such, if the need arises and one is available at your worksite, please apply the AED and follow your training. The second special consideration is oxygen administration. Oxygen administration is generally considered an advanced first aid skill and not for standard first aid providers. It is not included in the standard first aid certification. However, some work sites will have oxygen available but will not have an advanced provider on site. As such, an employer must provide additional training to enable a standard first aider to provide an oxygen. This training must provide all the equivalent information in oxygen administration as taught on the advanced course. If you have this additional training, please feel free to administer oxygen as per your training. If you're not trained, refrain from using it even if it is available at your worksite. The final special consideration for discussion is the administration of medications. According to Alberta Occupational Health and Safety legislation, workplace first aid kits should not contain any medications. However, a standard first aid provider may assist a person in taking their own medications. Assistance may involve getting medication from a locker or opening the pill container, but the patient must administer the medication themselves. The last topic for this presentation is a discussion of the difference between wilderness and workplace first aid. These two approaches have a very different perspective on patient care. Wilderness first aid is designed for remote areas where medical care is hours or days away. Workplace first aid is much less risk tolerant and relies on the availability of professional medical care. Some techniques and treatments taught in a wilderness first aid are not approved for use on a work site. You need to be aware of these limitations. First is the administration of any medication is not allowed in workplace first aid. Raven Medical's wilderness first aid supports the administration of some medications. If you're providing care at a work site in Alberta, do not administer any medication. Rather, call 911 and arrange immediate transport to medical care. The second difference is wilderness first aid's approach to wound care. Wound irrigation and the removal of impaled objects are not approved for Alberta work sites. The standard of care in the workplace is to leave impaled objects in place and apply a supportive dressing. As well, no wound should be cleaned or irrigated in a work site. Rather, apply dressings to the wound and transport to the hospital. The final difference is in the performance of CPR. In the unfortunate situation that you're performing CPR at a worksite, do not stop. Call 911 and continue until the care is transferred to the paramedics. Let's review some highlights from this presentation. First, you need to be aware that every worksite has to have a first aid plan. As well, if you administer first aid on a work site, a report must be completed, and that report must include your name and a description of the first aid you provided. Some special considerations at worksite first aid is that AEDs and oxygen may be available, but you can only use them if you're trained in those specific pieces of equipment. As well, on work sites, no medications can be administered. Other differences between wilderness first aid and workplace first aid, in addition to no meds being used in a workplace, is impaled objects must be left in place, bandaged and transported to the hospital. As well, wound irrigation, cleaning, and debridement is not a procedure done on a work site. For all wounds, you apply a dressing and transport to the hospital. The final difference between workplace and wilderness is that if you do start CPR, you must continue CPR until relieved by the paramedics. For more information on Alberta's workplace first aid regulations, please refer to the bulletin First Aid in the Workplace. It can be found by searching Alberta FA020 in any search engine, or by visiting Alberta's Occupational Health and Safety website at alberta.ca/occupational-health-safety. Thanks for watching. I hope you enjoyed this presentation. This video is the first part of the Raven Medical Online Blended Workplace First Aid Certification. Please review the 2 additional video presentations, eye and cold injuries. Finally, you must successfully complete the online test to receive your certification. If you have any questions on this program or any of the other programs that Raven RSM provides, please contact the office via email at info@ravenrsm.com or by a toll-free number 800-888-0287. Again, thanks for watching, and I hope you enjoyed this program.